I hope you're having a great day. Today will be a busy one because we'll organize everything for you to go home. I would like to share with you some information about the medication we're going to send to your pharmacy. There's going to be three medication. The first one is a pain medication. It is usually hydrocodone or oxycodone. Those are narcotics or opioid. I'd like you to take them as prescribed, but that doesn't mean that you have to take them regularly. So if it doesn't hurt, you really don't have to take them. You can also take some Tylenol with them as long as there's no Tylenol already included in your pain medication. So if Tylenol is enough, then don't take the pain medication. And also, I'd like to remind you that those medications are addictive. So that's why I will not order refills on those medications. So that was the first medication. The second medication is called Zofran. Zofran is a medication that can decrease nausea. It can decrease vomiting. So that medication you take as prescribed and as needed. So if you're nauseated, you take it. Now we know that the narcotics can cause nausea. So if it's difficult for you to control your nausea with the Zofran, try to cut down a little bit on your narcotics. And finally, the third medication I prescribe is a blood thinner. The goal of the blood thinner is to decrease blood clot. We don't want the blood clot that forms in your leg to detach and go to your lung and cause a pulmonary embolism. That could be dangerous. So that's why we're prescribing some blood thinners, and I will prescribe one of the three medication, either aspirin, a baby aspirin twice a day, Eliquis, or Xarelto. They're all blood thinners that you take by mouth, and they're usually easy to manage. Those are the main medication that I will send to your pharmacy. Now, the hospitalist might send you other medication, you will see that in your update when you're discharged. First of all, you can see that you have a dressing on your leg. That dressing has to stay there until I see you next week in the office. That's the time that we're going to just change it and apply a new one on it. So you don't have to do anything. Now, if it bleeds through, do not hesitate to add some gauze. If it bleeds through too much, please call our office and make an appointment sooner than the follow-up so that we can change it for you. With the dressing on, you're allowed to shower, but you have to protect it. I don't want the dressing to get wet. So I usually recommend that you use the garbage bag technique where you put one garbage bag and tape it above the dressing, and then you double that by adding another garbage bag and you tape it above the previous one. So that should give you enough protection to take a shower. Should it get wet, again, you call the office and we'll be happy to have you come in to change it. Now, another thing you should do to minimize the pain is to elevate your leg. I usually recommend that you elevate your leg above your heart level. So if you're laying down, the leg should be above your heart level. Same thing if you're sitting in a recliner. By doing this, it will decrease significantly the pain. You can also ice. We recommend that you ice 10 minutes per hour and you don't put the ice directly on the skin. For you, it shouldn't be a problem because you have a dressing on or a splint. Now, every time you will put your foot down, it will throb. You'll feel the blood rushing down, and you'll also see the toe getting bluish, and that's all normal. So that will decrease over time. So to minimize the pain, obviously just keep your leg elevated. Now, for the weight-bearing status, if we've given you the instruction to remain off your foot, it's critical that you don't walk. That's why you were evaluated by physical therapy, so they can teach you how to move around with crutches or a walker. Now, the other device that could be very beneficial is a knee scooter, and you can buy that online for about $110. So just go on Amazon or Walmart or any other suppliers, and you can get a very good scooter, and that will save your life. You'll really enjoy it. So that ends what I had to tell you today. If you have any questions, please do not hesitate to call my scheduler. That's the person you met before the surgery, and you should have her number in your package. And then if she cannot answer your question, then she'll refer them to us and we'll call you back. Thank you.